Here you go. Okay, so quickly going through a few housekeeping rules. Mute yourself, put the questions in the chat box. I'm going to quickly run through this video, which is a promo video for Pain Talks, just telling you people who are new to Pain Talks platform. It just gives you why it's called Pain Talks and what does it have. Okay, so basically that's Pain Talks. The idea came from TED Talks. If you have never heard of TED Talks is basically a very famous platform where quite a lot of influencers or speakers who come and talk on various topics. So Pain Talks Education, we have used this platform. This is a free platform where we share talks on various clinical topics. We tell you about various educational resources. We tell you about upcoming events and conferences. We tell you about examinations in pain medicine. We have ran a webinar on the FIPP exam with Professor Miles Day from Texas Tech University. And I've done a webinar on CIPS exam. And today we are repeating the exam webinar with a perspective from an examinee. So that's what we're going to do. So we tell you about the exam resources. So it's a pleasure to have Dr. Jorge Barbosa. He's from Lisbon, Portugal. And I'm going to read it out. Jorge has done a lot of stuff, okay? He's a physical medicine and rehabilitation specialist. He's a consultant in physical medicine rehabilitation. He works in the department in pain unit of Centro Hospitalar de Lisboa Ocidental in Lisbon, Portugal. He's a coordinator of interventional ultrasound section of Portuguese Society of Physical Medicine and Rehabilitation. And he's also now recently done certified interventional pain sonology exam for World Institute of Pain. So it's a real pleasure to have Jorge on the webinar on Pain Talks. And I'll be handing over the podium to Jorge in the next few minutes, but let's go through a few more things. Okay, so educational resources. We established Pro Academy in the UK this year, beginning of January. It's basically a sister organization to Leicester Pain Education. We wanted to go on to the worldwide basis, but Leicester Pain Education was very much limited to UK. So this is a QR code, which I'll leave it for a minute. If you want to scan, this will take you to a WhatsApp group where we announce all the events, including Pain Talks, including Leicester Pain Education events in the UK. We also announce the courses in various parts of the world, which are run on the Pro Academy platform. So I'm just going to leave that for a minute. I'll just tell you what events are coming up next year. We have an event coming up in May in the lovely, beautiful Florence. So if you like Florence in Italy, do join us. We have a pain summit on the Nysora platform coming up in September next year. We also have an event lined up in Cyprus next year. I am just finalizing the dates with my colleague Rahul, who's a director of Pro Academy. So we'll be announcing all these events on the Pro Academy World Events WhatsApp group. So do join on this group. So if you heard of Netflix, you must have kind of, thought, okay, why not something related to Netflix, related to pain medicine? So we've created an educational platform. This is the video platform called Painflix. The website is called www.blockit.club. There are multiple courses on this website, which can be very helpful. Hours and hours of educational material available in the form of video platform. The website looks like this, very much similar to Painflix. There is a course on masterclass anatomy, so anatomy series. The reason I'm putting this is this can be very, very, very useful educational resource if you're planning to do a CIPS exam, because this has 4 parts: spine, upper extremity, lower extremity, thorax, and abdomen. And if you look at the CIPS syllabus, all these areas, anatomical areas, are basically covered. We also worked with Professor Bernhard Morgel from Austria in Innsbruck. He has worked, on these educational videos, which are available on the Painflix website on blockit.club, and it's called Pain and MSK Sonology Video Manual. We have books to read, but if you have all that content available in the form of video, you will be able to grasp the material quicker, and you will remember it better, and you will remember it for a longer period of time. And not from the examination point of view, these videos will help you in your day-to-day clinical life when you perform the procedure. So it's a very good quick revision tool, and George will tell you what kind of resources used. Another recommended course is state-of-the-art virtual course series. This will help you for your clinical work. We have done this state-of-the-art virtual course series for upper limb, lower limb, and spine. So check this out. I work as an editor for ultrasound pain app for NYSORA platform, New York School of Regional Anesthesia. And recently we have released quite a lot of illustrations. The app is going to be updated. So do check out the ultrasound app on the NYSORA platform. So these are quite new illustrations that are basically now going to be uploaded on the NYSORA's pain app. Events in 2023, next weekend on Saturday and Sunday, we have this lovely event coming up in Dubai. We only have last 3 places left. If you are in Dubai and if you want to join us, do join us, because we're going to be house full soon. So I'm just going to quickly run through this promo video. Okay, so this was basically a quick promo video for this international workshop that we conduct in Dubai next week, and Saturday and Sunday. It's on joint spine denervation, MSK injections, and regenerative medicine. We have delegates from 13 different countries on this this event already registered. As I said, there are 2 more places left. If you guys want to register, please act quickly. We have another event coming up on WIP platform in Antalya, in Turkey at the end of this month. I'm going to be there. There's a CIPS and FIPP exam that's taking place on 31st of October. And then in Leicester, if you're from the UK or Europe, and if you want to come to curry capital of the UK, Leicester, we have similar event that we are conducting in Dubai, is also going to be replicated in Leicester on 7th and 8th of November. It's covering everything related to joint and spine pain management, radiofrequency, cryotherapy. We're going to talk about ultrasound guided injections, MSK injections, bursa injections, ligament injections, nerve injections. So we're going to cover a lot of things on this website. Okay, so Prague, we have a event coming in Prague on 10th and 11th of November. This is in Hotel Jalta in Prague. This is Pan-Europe Interventional Pain Management Update Series. To book this course, you can go on to www.bookcpd.com. And if you are planning to do CIPS exam in January, then join us on the NYSORA platform in Leuven in Belgium on 2nd and 3rd of December for the CIPS preparatory and ultrasound comprehensive course. So there are many more courses on the NYSORA platform next year. January, we are going to be in Tampa, and then February, we're back in Leuven. March, we have Houston. July, we have Leuven, and then November, December, we have Leuven. So plenty of stuff. In Leicester, we are running cadaver courses. If you're interested in cadaver courses, there'll be cadaver courses taking place in Leicester. So do drop an email on the dproacademy.club@gmail.com, or check out the website dproacademy.club or www.blockit.club. So that's it. In regards to the pain talks, we try and record these, and we would try and put this on the YouTube channel, and also we put a link on the Facebook. These are the previous talks. All of them are freely available on the YouTube channel. So go and search for pain talks on YouTube, and you'll be able to access all the previous webinars. Okay, so that's it from my side in terms of the upcoming events and the educational resources. Now, I'm going to run through a few slides for the CIPS exam as an examiner, and then after that, we're going to switch over with George, and George is going to tell us about what he did to prepare for the exam. Okay, now CIPS exam is conducted by World Institute of Pain. Now, what is the reason to have an image guidance in pain medicine? If you look at this publication back in 1953, John J. Bonica, he actually told the importance of use of fluoroscopy imaging to perform the pain interventions. It took almost half a century to become that as a standard. We know image guidance improves the accuracy, improves the safety. So it's very important to use image guidance in your day-to-day life. And why do we need certification? WIP board, this is from the WIP bulletin. They say the reason you want certification is to establish knowledge and skills, domain of practice of pain medicine for certification, to assess the knowledge and the application of ultrasound-guided interventional techniques in pain medicine, to encourage professional growth, to formally recognize individual who meets this requirement by WIP Board of Examination, and to serve public by encouraging the quality of patient care. I think having the exam and title is a minor thing, but the amount of study you do to pass the exam, the knowledge you gain, the skills you gain when you go through the exam process is what helps you to be a better physician in your day-to-day life. Okay, so that's why it's important to kind of consider the examination if you want to go on to the next stage in your career. If you're using ultrasound or X-ray, these are the exams that are available. So this is the CIPS bulletin, and it's just telling you how the CIPS exam is conducted. It's conducted in two parts. The part one is the theoretical part, which has MCQs. There are 104 multiple choice questions. Okay, you get 2 hours and you have to do the MCQs. And George will tell us what kind of resources he used to pass the MCQ exam as well as practical exam. The practical exam, you have 2 parts in that. You have first part is the cadaveric procedures, where you have 4 procedures to do on the cadavers. You have 60 minutes. You have 2 set of examiners, and the candidates will have 15 minutes each to perform the procedure. Now, as an examiner, I can tell you, you don't have to do the procedures in the order they're given you. You can choose the order the way you like. So, for example, they've given you 4 procedures, and one you think is very easy, you have very confident, you can start with that procedure. You don't have to start with the order they have given you. Okay, but you need to finish 4 procedures in 1 hour. Whilst you finish the procedure, they will always ask you, is this the final position of your needle? And if you say yes, then they freeze the screen, they save the image, so that there's no discrepancy, there's no argument that okay, this wasn't the right thing or that wasn't the right thing. So usually they will always ask you, is this the final position of the needle? And you say yes, we freeze the screen, and that's it. So that completes 1 procedure, and you have to do 4 procedures. Now, procedures, these are the areas, and as I said to you on the blockit.club website, we actually have done anatomy workshop on this. So it kind of covers spine, it covers the joints, upper limb, it covers the soft tissues and peripheral nerves. So these are the areas that you have to basically focus on, and you have to do one procedure from each area. Okay, so there are 4 procedures. You have to do one procedure from each area. Now, part 2 is an oral exam where you have sort of, clinical scenario that will be given to you. You'll be given about 5 minutes to prepare for the clinical scenario. There'll be 2 set of examiners. Same examiners who are there for the cadaver exam will accompany you for this particular part of the examination as well. It's a viva voce examination, the oral examination. And what it does, it basically gives you a case scenario, and then you have to, there might be a model who you may have to examine. It's like a patient, you have to introduce yourself, you have to examine the patient, and then you will have to use an ultrasound to kind of scan and show them the procedure. Okay, so it's 30 minutes case-based scenario. They'll assess your clinical knowledge, what you're going to do for that patient, and these are the clinical scenarios or clinical vignettes that they will be assessing on peripheral nerve injury, headaches. So these are the areas that you need to be proficient when it comes to you assessing the patient and treating the patient. Okay, so as an examiner, these are the tips that I would give you. You need to be calm. You need to keep yourself calm. I know it's very easy to say that, keep yourself in the exam. The nerves do creep on, but try your best to keep calm. Examiners are usually very helpful. None of us want to fail you. We all want colleagues to pass. Choose any order of the procedure that's allocated to you. Try and position the cadaver, get the cadaver position in the appropriate position. So for example, if you're doing a greater trochanter bursa injection, try and tell them, can I have the cadaver position lateral? And they will do that. They will bring people to position the cadaver in the lateral position. Okay, so you don't have to be hesitant. Ask them, they will do it for you. Okay, then when you're examining the model, treat them as a real life patient. When you're examining the shoulder or knee or hip, try and be gentle. Do what you do in your day-to-day life. Okay, management, always try and tell them, I will do biopsychosocial approach for helping this patient with pain management. Don't straight away jump on the injection. None of us do straight away. You treat them with other things like medication, physical therapy. If they have got psychological issues, send them to a psychologist. But you always tell them that that's what we will do. We don't straight away jump for the injection. We do other things first, and then injection is a part of the whole package. When you're scanning, try and explain to the examiner. You can be very quiet throughout. You don't have to do a running commentary, but it's always useful to actually explain whilst you're scanning, so we as an examiner know what you're looking for. For example, if you're doing a cervical facet joint injection, you're going to say, okay, this is peak, this is trough, this is cervical facet, and I'm going to go out of plane. So you talk, it helps us to understand. Or you don't have to talk, but if you talk, it's always better. And do what you do in your clinical practice. If you are doing a procedure which was taught on the workshop, but you do it in your clinical practice differently, do it what you do in your clinical practice, but make sure that you're safe, because the exam is all about assessing the safety. When it comes to the clinical examination, these are the clinical examination areas that they will look for: shoulder, hip, knee, lumbar spine, cervical spine, and neurological examination of the upper and lower extremity. So, as I said, there is a course that we are running in Lisbon at the end of the year on 2nd and 3rd of December. If you're planning to do a CIPS exam, the next one is in Turkey, as I said, in October, and then after that, there'll be exam in January in South Korea. So I think if you want to go and do the exam there, then you can do the course in December on Nisora platform, and then you can join me. Okay, so what are we gonna do? You can write the questions in the chat box, but I'm gonna get George on the podium, and George will basically so George, I'm going to ask you to unmute yourself, and we will go through a few questions that I have, and then okay, so question number 1, George, is how did you kind of plan your studies in terms of what were the resources you used to pass this exam? What were the things that you collected first? Because before you build the building, you need building blocks, you need doors, you need this, you need that, you need all the material. Okay, so what material you used to actually pass the exam?
Hello, Dr. Sadiq Bayani. Thanks very much for the invitation. Well, first of all, I think before deciding to take the exam, I wondered, why do I want to do the exam? Because in several countries we have different systems. I'm from Portugal. In Portugal, we have the just for ultrasound in diagnostics, we have the radiologists, but we don't have yet a certification for ultrasound intervention guided procedures. Several specialties we do that, like PM&R, anesthesiology, rheumatology, some orthopedic surgeons as well, physical medicine, sports medicine doctors. But I think it's important to have international certification granted by a prestigious institution like the World Institute of Pain. But I think the best is the certification, because of course, any one of us can make mistakes, but if you do an exam and if you prove that you meet the requirements in the study, prepare the exam, and you have experienced, I think the probability to have a mistake, to make an error, is going to be inferior instead of compared to someone that don't take the exam, or someone that just go to one or two ultrasound courses and they just want to start practicing and doing spine and doing everything.
I think
Well,
you made a very important point there, actually, George. I think if you have done the exam is there to do the assessment, okay? And if you have been assessed and you've passed the exam, that actually in itself proves the fact that you're proficient, you're safe, and you will do the procedure safely. So I think from medical legal point of view, if there has been a mishap, obviously things happen in medicine, but if you have done the exam, that is in your favor, telling you that you've taken necessary efforts to have the assessment done, and you've taken necessary effort to be safe doctor performing the procedure. So I think it's very important, the very important point you made, why to do exam in the first place. Okay, let's move on to the second question then. What was the resources that you used for the exam? What resources you collected?
Yes, the resources. Well, I didn't have a lot of time to prepare for the exam, but in my case, I had to do a straightforward study. I looked at the CIPS bulletin. I looked at, there was three parts of the exam: the oral, the practical, and the theoretical or written exam. And I tried to prepare the best as I could for the three parts. Well, for the written exam, for the theoretical, I read the MCQs in regional anesthesia and pain medicine by Dr. Herman Shemby. Well, if someone in a webinar wants me to confirm the name of the books or name of the sources, I can give you at the end my email, and I'll confirm all the references. So that in that MCQs book, it was very important, because for the theoretical part, we have 100 questions. For each question, we have 4 possible answers. And the book, it covers a lot. It covers pain therapy, it covers ultrasound physics, knobology, equipment, upper limb, lower limb, spine procedures. And I think it's an important book. There are a lot of questions that, if we have some experience, we can already answer the questions, because one thing that is important, if you want to apply for the exam, you have to have a license to practice medicine. You have to finish at least a 4-year residency program, and including pain medicine, and you have to have at least 1 year of experience. So with all of that, some of the parts of the exam, we are already prepared to do that, but these resources can give a very good help. So that book, MCQs in Regional Anesthesia and Pain Therapy by Dr. Herman Shemby, is a very good resource. After finishing the exam, I was doing more research, and now I acknowledge that there's another MCQ book, and it is MCQ in Pain Management by Dr. Rajesh Gupta, and I think it's recent, and I think we can also consider that book for the theoretical parts of the exam. Well, for the oral part of the exam, the oral part, it's very interesting, because in that part, you are in front of 2 examiners. They give you present a clinical case, and they ask questions about that case. Differential diagnosis, what exams that you would request, what's the final diagnosis, what's the management. You also do in front of them a physical examination and ultrasound examination. And a book that I read, it's I can also recommend that book. It's the Evidence-Based in Interventional Pain Medicine. That evidence-based book by Dr. Martin van Cleef and Dr. Jan van Zundert, that Evidence-Based Interventional Pain Medicine, they have it all for headache, for upper limb, lower limb, spine, cancer pain. They cover different topics, and they cover not only the ultrasound examination, but also the physical examination, differential diagnosis, the management. And it's a quick book to read, and it's a big help. We as a physicians, and I think that's a very important part of the exam, the oral examination. We just want not to do just to pinch patients. We also, before that, we have to have a diagnosis. We have to know what's the best plan for the patient. And independence where we are PM&R or anesthesiologists or sports medicine, orthopedic surgeons, we also have to have a strong basis. And with that basis, we can consider what's the best option for the patient. And then we do the physical exam, the ultrasound exam, and then we do ultrasound guide procedure. So that's the last part of the final part of our procedure. And with that oral
sorry,
examination.
George, can I just recap? So people, few people are nicely demanding, saying need references and names, but I've written the names. Okay. So I think you told us that for the MCQs, Harman Sembi is a very good friend of mine, guys. He works in Canada, in Western University of London. He wrote his book when he was a fellow in Frimley Park in the UK. So Harman Sembi's MCQ book in regional anesthesia pain medicine is a very good book. Core topics in pain medicine by another great guy, Rajesh Gupta, late Rajesh Gupta, unfortunately passed away during the COVID times. So he's written really good book. And that is very useful, right? George, I'm just recapping things. And for the practical part or the oral exam, evidence-based interventional pain medicine, this is the book from Benelux chapter of WIP, Martin Van Cliff and Jan van Zunder. And that's a very good book to read. You don't have to book the read thoroughly, but you can read the flow charts of the book. It tells you patient with neck pain, how you're going to assess, and what's the evidence-based approach. Cervical medial branch block, if that's diagnostic positive, you do radio frequency. So read through those flow charts. Sorry, George, I interrupted, but few people wanted the references, so I thought I'll just recap it. Okay, yes. Let's go on to the next part then. So practical part.
No, I'm sorry. Yes, practical parts. Do you want me to tell the references for the practical part?
Yes, please.
Okay, so for the practical parts, the examination or the exam organization, they can recommend us some articles, and the articles that they usually recommend are the protocols from the American Society of Regional Anesthesia, Professor Peng's articles from the American Institute of Ultrasound in Medicine, articles from the European Society of Musculoskeletal Radiology, and also from the PM&R clinics of North America. Those articles are they're protocols for the joints, upper limb, lower limb, peripheral nerve, cervical spine, thoracic spine, and lumbar spine. They're ultrasound protocols. They are very useful. Well, another thing that I recommend for the practical part that normally the CIPS examination is included in the event, in a big event. In my case, in Budapest, it was the 26th International Conference. Gabor Ratz, it's a very well-known pain medicine physician from Hungary. Now he lives in the United States. And in 31 of October, the CIPS examination is going to be the day rightly after the World Institute of Pain International Congress. Well, normally, before the CIPS examination, the days before, they have a CIPS preparation course, and I'll really recommend it, because in that case, you have contact with the examiners, and the examiners, you practice ultrasound guide procedures in cadaver the days right before the examination, and you get to know to them, you feel what they think there is important, not only for doing the procedure, but also to tell them if it's safe or not. For the practical part and cadaver part, you do the procedure. If you don't want to talk too much, you can, if you want to, you can talk, but they can ask you questions. So they're going to ask you, it's their final little position, but they also can ask us, so this is a cadaver, so we're not going to turn Doppler on, but which structures would you avoid during this procedure? Which nerves, which artery, which vein? And you have to tell them. And to have contact with them the days right before the examination, I think is very useful. Well, before the exam that I did in Budapest, it was in September 3rd. Well, I also did different courses. So I was in July in Leuven for an ISORA course, ISORA for ultrasound guided in interventional pain management. It's a comprehensive workshop. That workshop included as well CIPS, CIPS examination preparation. It was in July in Leuven, and NISORA, they have several courses, and that particular workshop, they have it several times a year. The next it's going to be in December in Leuven again. And so normally it's a 2-day workshop. You have contact with some examiners, CIPS examiners, like Dr. Sadiq Bayani, and CIPS tips. And a part of the workshop is also CIPS preparation instructions. I also recommend that. Another thing another resource that I think it's very, very useful is to go to the Painflix, blockit.club. In that platform, you have a lot of material, you have a lot of online courses or also on-site courses that were recorded as well, and covering all of the topics that are included, that are important for the CIPS examination. And one of the courses that I recommended, it's the Pain and Musculoskeletal Phonology Video Manual. And the coordinators are Dr. Sadiq Bayani, Professor Morigel, and Professor Morigel. That in that video manual, you have a lot of small videos covering ultrasound guided procedures in everything: upper limb, lower limb, spine, facial pain, and they cover more than is requested for CIPS examination. It's a very straightforward, small videos, and for the practical part and also for the theoretical part, you learn a lot that can be useful to do the MCQ question in the examination. Well, another resource that was very important for me as well, it was the Licensure Pain Education YouTube channel. In that channel, you have pain lectures. You have a lot of videos as well of ultrasound guided procedures covering it all. And most of the videos were recording during actual on-site courses. So they are certificated videos that are were made during the courses. And they also, the Licensure Pain Education, it's a free channel. You also have access to the physical examination videos. And that physical examination videos are important for the oral parts because the examiners are going to ask you to do parts of the physical examination. And there are some subjects that you used to do in everyday practice, but there's like sometimes cranial nerves and some foot examination. Maybe in your regular practice, you're not doing the regular. It depends on your specialty. And watching that videos can also prepare for you to the oral examination. So that was the resources that I used because I didn't have a lot of time. I used most of my holiday to study. If I was planning to go in October in Antalya, I couldn't do it because now I'm fully booked from Monday to Saturday. So I had some times, but there are different ways to do it. If you have more time, and there are people here in the webinar that already applied and people that are considering if they want to apply or not for the examination. If you have more time, there are also comprehensive books like the Atlas for Ultrasound Guided Procedures in Pain Medicine from Professor Samer Naruz, and also the Ultrasound Guided Procedures in Pain Medicine from Professor Peng. Those are more comprehensive books. In my case, just having 1 month to study, I didn't have time to do it. But if you have doubts and if you think the material, the content is not enough in the other resources, those are more comprehensive books. If you have any doubts or if you have a lot of time to prepare for the examination.
I can tell you, I think, George, majority of people who are doing the exam, the time is never enough. And I think, hats off to you, managed to cramp everything in good 1.5 months, because I remember I met you in July on the NISORA courses. You're going to do the exam in August. But okay, you only have 1.5 months left. But I just say that I think if you have good resources, then, you could basically look through this, resources. And as I said, I've just typed things. So, I'm going to quickly go through questions, George, whilst we're there. So I've already told the books for the MCQs, Harman Sembi, core topics, Rajesh Gupta. For practical part, YY exam, evidence-based medicine, Martin Van Cliff and Jan Van Zunder's book. Ultrasound protocols, AIUM protocols, they're quite useful as well. Then in terms of preparing for the exam, especially from the practical point of view, resources are video manual, which you will find on blockit.club, www.blockit.club. So that's the website which will take you to Painflix. Okay, so we couldn't get the domain of Painflix, so we got the domain of www.blockit.club. So that has Pain as MSK video manual. There's plenty of videos which are very short. And if you want to do greater occipital nerve block, Prof. Moregal teaches you like in 10 seconds how to scan it, how to put the probe, and how to do the procedure. So you have very short videos of all the areas in the body. I think there are like 58 videos. There are some long ones as well with regards to the anatomy, but so check that out. Leicester Pain Education YouTube channel is a free resource. Then the other thing is the NYSORA course that we run every kind of 3 times a year. It's not only just a comprehensive course of ultrasound, it has a CIPS preparation because we give you all the tips and tricks on how to pass the exam. So I think that's something that you can attend, and also attending a course just day before the exam, which usually they have it at every exam venue, can also be helpful. Okay, George, few more questions. On the day of the exam, now you told us the preparation, you told us about what resources to read, you told us what time span you can do to invest to pass the exam. Can you tell us on the day of the exam, how was it? What did you do on the day of the exam, and how did the exam kind of flew in terms of the flow of the exam? How was it conducted?
Well, the organization was very good. So we met at a hotel very early, about 7:30 p.m. And then all went to the faculty. In our case, it was in Semmelweis University in Budapest. And then we were divided in 2 groups. One group started with the practical part, cadaver part, and then in the morning, and then in the afternoon after lunch doing the other parts of the exam. And the other group doing the opposite. In my case, I started with the practical part. There were 4 procedures assigned to me. There were the 2 examiners. I had 1 hour, 15 minutes per procedure. I think it's enough. I think if 15 minutes, if you're thinking about being in a group with more 3 or 4, 5 persons, it's not a lot of time. But you're all by yourself. Take your time. So 15 minutes per procedure, I think it's enough. And you read the CIPS bulletin. There are procedures on the spine, peripheral nerve, musculoskeletal joints, musculoskeletal soft tissues. So 1 procedure per region, and they have the list of the procedure, and 4 procedures that in the list are going to be assigned to you. So there are no surprises. If you prepared for and you study and you prepared for those procedures, I think you were okay. And in my case, it was the 4 procedures. It was the selective cervical nerve root block, alloinguinal alloepigastric nerve block, biceps tendon sheath, and also the hip joint injection. And so after that, I think it went okay. The examiners asked some questions. It's your final little position, and they also asked me. So in this case, what artery should we avoid in case of the biceps tendon, to try to not to pinch the lateral circumflex artery. In the case of the cervical nerve root block, try not to pinch the root. You have to say this is a cadaver, but in real case, I would turn the Doppler on. I would see if there was an anatomic variation with the vertebral artery or some feeding vessels. So it's important that they acknowledge that you're not just good with the needle, putting the needle right near the structure, but if you in your regular practice, you do it in a safe way. So I think it was okay. The first part, I started with the practical part, and then after lunch we went to the after the practical parts, we went to the oral examination. It was directly first the practical, then oral examination. And in my case, the same examiners of the practical parts were the same in the oral, and they gave me a clinical case to read. I read a clinical case. In my case, it was a young man that 2 years ago he had an accident, and after the accident he had a shoulder trauma, and then he started with numbness, tinglings of the upper limb, had lack of strength, mainly on the shoulder, and so can have several cases. They can ask a case. That was my case, but they can ask a case about headache, about upper limb, hip, upper limb like shoulder, elbow, wrist, hands, and lower limb like hip, knee, ankle, foot, or peripheral nerve entrapments like myalgia paresthetica, like carpal tunnel syndrome. And you also in the CIPS bulletin you have a list of all the possible teams of the cases that they can ask you. And the book, the evidence-based pain medicine, I think it prepares us good. It's good to prepare for that part of the exam. And then they asked me differential diagnosis, what would you consider, what exams would you request, what's your final diagnosis, and then they asked me to do a physical examination. I did the shoulder physical examination mainly, and because the patient, the case had numbness, tingling. They also asked me to do ultrasound examination, not only the shoulder, but also some ultrasound of the cervical spine. And after those exams, we have a real model, a normal model that we can do that physical and ultrasound exam. They asked me the management. So what would you do? And they just don't want just the ultrasound procedures. They want an holistic management, like the patient education, other options like medication, physical therapy. So you can all of the options that you can see the patient can benefit. I think you can tell the exam it's going to give you a more richer exam, and also some US guided procedures that we could do in order to decrease the pain, in order to get more range of motion of the shoulder. And I also did that, and also put the probe, and I showed it. How would I do it in a real case scenario?
So did you do suprascapular nerve block for this patient, or was it a rotator cuff tear and you needed to inject the PRP for the rotator cuff tear? What was this scenario?
Yes, he had a partial rotator cuff tear, and they asked me how would I do it, an injection. If I put it I said the PRP could be a good option. It was a young patient with partial tear. They asked me if I put the PRP inside the tendon or in the bursa. That's can lead us to some discussion. In my opinion, depending on the size of the tear. If you have a minimal tear, I wouldn't make a lot of pressure in the tendon, but that can be different opinions. They also asked me to show where the axillary nerve is, if the patient had chronic pain, and if we would consider a nerve block or possible later a radio frequency. They asked me where this. I showed where the axillary nerve was, the teres minor muscle, and then they asked me for where to show where was the C6 and C5 roots, if I would consider a selective nerve root block. Well, and so those were the first parts of the exam. And for both parts in the CIPS bulletin, you can see that 60% of the exam is the practical, 20% the oral, and 20% the written. And for the practical and the oral as well, the two examiners, they can give you 4 types of grades. One, the lowest, it's unacceptable, below basic competence, and your decision could be harmful for the patient. The number 2, unacceptable, below basic competence, but not harmful for the patient. Number 3, acceptable and basic competence. And number 4, acceptable and exceeds basic competence. Well, after some weeks after the exam, I just knew that I passed. They don't give you the results. You don't know if you pass with a very good score. I just know I passed, and for me, it's enough.
That's
But
true. I think that's the thing that we get briefed. So if you actually are dangerous, it doesn't matter whether it's one procedure, two procedure, you are dangerous. So I think it's very important to keep in mind, do whatever you need to, but be safe. You know, you will still pass the exam if you're safe, okay? But if you're dangerous, then it becomes very difficult for the examiner to say, okay, I'm going to allow this person to pass the exam and go out and start doing injections. So just be safe. Safety comes first when it comes to the exam assessment. But that was a good thing that you gave us the grading system. I was going to say that, but you already told us. Okay, and how long did it took to results to come through, George? How many weeks they took to give the results?
they took about 4 weeks.
Okay.
Yeah, they said at the end of the exam that they could take about 6 to 8 weeks, but in the 4 weeks we had the results by email. We received the emails with the results,
Okay.
and for I forgot to say the last part of the exam. So it was the written exam. It was after lunch.
Yep.
We are all a little bit tired, but it was a more calm part of the exam because you don't have you don't have two examiners in front of you, and you have 100 questions, MCQs, 4 options for each question. Just one of them is right. And if you have some experience in ultrasound, I think you can answer a lot of the answers. There are some answers that you know from your regular practice, but if you study, of course, I recommend people to study to have the better score they can have, because there are also a lot of questions that I just could answer because I studied.
Sure. Now, one question I have here from Saeed, he says, in oral exam, do they ask you to demonstrate the entire physical exam, or will they ask you to demonstrate specific physical examination test? So in your shoulder examination, did you just do the whole examination, or did you mention them like specific tests, like, Near's test and empty cast test and all that kind of stuff? So what did you do?
No, this they just ask specific parts. They don't say uh, make a physical examination of the shoulder. They ask how could you test the strength of the abductors? How could you say if how which test would you do to if you suspect there is a supraspinatus tendon injury, or if there was a subacromial impingement? They are more directed. They direct you to the specific parts. They also ask me if you suspect he has a C6 impairment of the sensitivity, which is the territory that will do the sensitivity tests. They are
Okay, great. So it was like very much specific. Okay, I think it looks like people had a good grasp of what exactly you did for the exam and how you approached it and how much time you invested it and what happened on the day of the exam and how long it took for you to get the results. So thank you so much, George. I think it was very helpful to get your side, and it was very helpful to kind of know what kind of resources use. I think resources are very important when it comes to the exam, because these exams are expensive. I think it's $2,500 for the exam application. So if you want to pass it, you really need to have good resources to actually make sure that you don't lose that money, and you need to put preparation. I think there's no replacement to the preparation. You really have to put kind of preparation in place. So study hard, guys. People, I think there are a few people. Kevin is doing his exam in Antalya. So Kevin, come and find me. I'll be there in Antalya, and we'll meet up. And thank you so much, guys. Those of you who are doing the exam or planning to do the exam, I think, as I said, there's exam taking place in January, and it is also in Asia. So if you're planning to do it in January, we have actually planned a CIPS preparatory course in Taiwan, and it will be the preparation course is in Leuven in Belgium. Okay, it's on 2nd and 3rd of December, so just a month before, and I think it's quite useful to do that because you will get a really good refresher. And we teach all the exam blocks on the course. So see you guys. Thanks very much, and I hope you found this helpful. As I said, we just ran through the whole structure of the exam. So this was a very much focused webinar related to the exam. Okay, so if you have any questions with regards to the exam, then do drop an email, paintalkseducation@gmail.com. Okay, and I'll try and answer that. Or you can join the group, WhatsApp group of the Pro Academy. You can put the question on that. Okay, take care, have a good one, and enjoy the rest of the evening and rest of the day. Okay, thank you so much, George. Have a good one. Take care. Bye bye now.
Thank you. Bye bye.
Bye.
Take care.
Bye.